Group and AMC. Good morning, Doc.
Hey, good morning, guys. Good morning. It's, uh, it's very good to see the inauguration on TV.
What'd you think of that, Doc?
It's great. I tell you, it's time to move on and see if we can do better in this next 4 years.
Well, let's do better here on Guam, Doc. I don't know where to start here. Maybe we were the Physician Advisory Group. Are you guys meeting tonight?
We're gonna meet tonight.
You don't, or you do?
So we will. We
Okay,
meet
yeah.
every Thursday, Chris
Okay, all
Sabrina.
right, yeah.
Yeah.
So, what's on the agenda?
We still have to kind of follow up on the new quarantine guideline that we submitted last week. And because the mandated when the guideline from CDC that for international travel coming up here in the 26th of January. We again that guideline that we propose kind of follow almost follow the CDC guideline regarding requirement for the 72 hours PCR test prior to arrival. So we had to follow through with that because I think by the end of next week we have to implement some type of change.
Doc, and if you could, what and how will the quarantine policy be different if you guys approve what you're looking at tonight?
Well, when the proposed guidelines that we will require the 72 hours PCR testing prior to arrival, and then the Q factor is still in place, but hopefully we can test it out a little bit earlier just because there's 72 hours. We can test out to propose on day 4, day 5. To If it's negative, you can go home for the next 7 days quarantine with the Sarah Alert and the Guam COVID app in place. And also, if you positive, because a new strain of the COVID that just in the U.S. If you test positive, you will be under isolation factor for hotel for the next 10 days. You cannot do home isolation.
Wow.
That's a big change. You don't have just because with the new strain is so much more effective that it's a big risk for people in Guam if you do home isolation and you break the isolation at home. This is going to be a huge risk for what we have right now.
So, Doc, are these pretty much going to be the new quarantine policies, or is it something that you guys are just discussing?
We submitted to public health last week, so we're going to get some input from them this week because like I said, the 26th of January is coming up here, and they have to change that from the public health standpoint.
How about vaccinations? I know you guys have been doing the vaccinations at AMC. What's that been like for you guys, Doc?
No, so far, in the past week, we requested 300 more doses yesterday, so we come up to about 500 doses that we given this past week. We vaccinated the PD Homebound last weekend, and we're gonna try our best to do MTM this weekend. It's a lot of fun for us, and so it's very rewarding to be able to go out to the Homebound Manumgo and give the vaccination at home for them.
Is there a schedule or something, Doc? Because we do get a lot of comments about people wondering about the homebound vaccinations.
No, it's a volunteer. It's our nursing staff and want to extend their time to the homebound. We understand that a lot of people on call out clinic can request that. So we decided to put our team together and we try our best to do it. It take a lot of time for the staff. So we actually have to observe them at home for 15 minutes to 30 minutes. So it's very time consuming, but again, it's very rewarding. You see, it's amazing how this homebound Monunco have been at home for the past 10 months.
Wow.
And it's really nice to see the smile and the gratitude to what you do. So it's a nice program. So we're going to try our best to spend some time during the Sunday and go out to their house. So this weekend we're going to work with Mayor Paco and get the MTM homebound folks to be vaccinated.
So what's the process? I know you said there's not a schedule, but I'm pretty sure all the other mayors are hearing this and they're probably wondering, how do we get them to go to our village? So how do they get you to go to their village?
It's strictly volunteers on my staff, so um, we just have to take one at a time. I know that we have a lot of physicians that live in Jonia, so I know Jonia will be the next one in line. So we just have to go one at a time. Like I said, we don't have. It's just a it's it take the whole day to do because, like I said, we can sit everyone in the same room, so we actually have to travel from one house to the next, and it's very time consuming, So, but again, it's just a lot of fun for us.
Doc, what about the caregivers? When you go and you do these homebound vaccinations, are you also vaccinating the caregivers?
Um, yeah, when we vaccinate the homebound, we ask them, we would like to give the primary caregiver the vaccination also. So usually when we go out, we carry double the amount of vaccine, so that way we offer the primary caregiver also at home. And surprisingly, some of the primary caregiver are 60 plus. So it's a family culture environment, and when the primary caregiver are the children, and they are over 60.
Doc, we had a question here. I don't know if you know, but any idea when the next public testing for or public health will be conducting?
Um, you know, um, I think they test almost every day at the Northern Public Health site.
Right.
The Northern Clinic. They do that every day. So I know that if anyone want to do testing, they can go up to the Northern Clinic of Public Health in the north there to get tested. So I don't. I think they do that. 5 days a week.
And is that for anybody and everybody, or do you have to be symptomatic?
No. All testing right now is no. It's been changed a lot, so you don't have to have any symptom. That's for everyone. I know there's a limitation the number of tests you can run a day, because they use a Binax card to run at this point for the antigen test. But no, it's you don't have to have symptom to go there. If you symptomatic, you can go to the urgent care where they have the Abbott to be tested is more accurate on the molecular test with Abbott. So if you have symptoms, you go to the place where they have Abbott, and you can be tested there. I think there's a lot of places now that have Abbott, given out by public health. So you can go to those sites to get tested.
Doc, do you know offhand if the test being done at the Northern Public Health is that the rapid test or is that the 3 to 7 days?
That's a rapid test.
Okay.
That's the antigen, the Binax, 10-15 minutes, Chris. So it's pretty fast. It's not as accurate as the molecular or the PCR testing, but for screening and for the result to come back to you, is that's its advantage is that it's really quick, and even you test positive to antigen, they're gonna do a confirmation PCR testing on you, so make sure that it's not false positive.
What can you tell us about those 30 positives the other day? That kind of raised some eyebrows out here.
Yeah, I know that's over 1,000 people that get tested. We at this point we're gonna ask that question tonight to PAC because there's not much info released out of that 30, and I think that we're gonna recommend that they release more. I know that more information like quite a few that come out of the Q factor right now. I think 30% of the positive come out of Q factor. So that's something that it need to be made public, so that way people know that hey, the Q factor does serve its purpose at this point on try to containing the positive and the virus from coming into the island. And that's a huge advantage to have the Q factor. I know it's very expensive, but 30%, that's a lot from the positive.
So you haven't got any information on that?
No, we don't have. We're gonna try to find out tonight. I know they when we ask they do release to us, so we need to find out is that number one is the positive we need to know is that from the Q factor, that's number one. Number two is that through contact tracing that they're positive. Number three is that the new positive, because the one way that we worry is the new positive that have no contact to anyone that positive. So those are in the community that we really need to find out, because we need public health to really do the isolation and contact tracing as fast as possible in order for them to contain the virus. So the third one is most important, the new positive that have no contact with anyone.
Doc, are you concerned at all as we move toward this vaccination posture that things like contact tracing are kind of falling behind?
That's the question we always ask to see, because public health do the best they can. They have limited resource. Either they do, they have a lot of things that play their vaccination, their testing, their contact tracing. It's a lot. So I hope that the contact tracing and the surveillance team are intact and not getting pulled out to do other tasks, just because that's very important as we go through the vaccination program, that more tests need to be done rather than decrease the testing, because people, we try to pass a message that vaccination doesn't mean that you put your guard down, that 3W will continue to be practiced for everyone, because you can still have the infection even if you complete the second dose of the vaccine. Again, the key program, the key point for the vaccination is that decrease the death rate and decrease the hospitalization, but doesn't mean that you cannot be a carrier for the virus. So you still have to do the 3W that we've been doing the past 10, 11 months.
So, Doc, it kind of sounds like you believe we should be doing more community mass testing. I just texted Janella. I said, hey, when's the next mass testing outreach? She responded, we're working on a schedule. Hopefully we'll announce next week, because I think we're getting comments. People want to know where they can go get tested. And I feel like we need to make it really convenient. But the Northern Public Health testing is by appointment. So you're saying we need to do more testing?
We need to do a lot more testing. I tell you, that's a consensus for everybody. In the U.S., anywhere, that we need to do much more testing until this whole vaccination program is complete. And I don't know, the projection line for the immunization range anywhere from July all the way to December 2021. So it's a huge range, and because there's a lot of factor in there in play, supply, demand, and how we roll things out. So until we have 75-80% people vaccinated, we really have to be careful and do more tests, and again encourage people to continue on the 3W. You have to.
And the 3Ws again: wash your hands, watch your distance,
wear your mask,
and wear your mask.
Watch the distance.
Got it.
Yes. And don't let your guard down. We have a few cases already that, when you get the second vaccination dose, that you still turn positive. So again, you have to practice 3W. And the question we get asked a lot is that when we get the vaccination, do we turn positive for the test? And saying no, the vaccine does not make you turn positive on the test. No, absolutely not.
Doc, you said that we've had a few cases where people have tested positive after their second dosage. How many cases are we talking about? Because I only knew of the one with the firefighter.
Yeah, I think it's the firefighter. And I think there's another one that I heard of, but I'm not sure where it's coming from. But that you have to still practice the 3W. And again, if you have the virus after the second shot or the first shot, then hopefully your symptom are not so severe that you end up in the hospital.
Hopefully.
Yes, and that's the key. So I highly encourage everyone to get vaccinated when that turn come, but you should have no hesitation on vaccination. There's very little contraindication of not getting them.
All right.
So, okay, so get your shot.
How far are we away from anybody just being able to go to AMC or whatever clinic and saying, hey, I want to get vaccinated? Because I know we're doing the priority categories now. There's a little bit of a backup with the teachers and whatnot. But how far are we away from that day, Doc, where it's just open for everybody?
What we still push is, guys, we push for most of the clinic that they feel comfortable to give the vaccine out, from their clinic. It'd be very helpful because them a lot of clinics see patient every day and the patient right in front of you. And I know that program rolled out kind of slow, but I highly encourage the most clinics to participate in the vaccination program. I know AMC have it. I think Higatnia Meds. That's why I heard this. They also have it, but no, SCA and FHP really need to get on board because they have a huge amount of panel patients to get vaccinated, and that will help a lot. So right now for AMC is that if you come in, with your appointment, you will if you meet the 60 plus, you will get vaccinated, and we also come up with a list of patients that's 60 plus and over, either is AMC patient or not AMC patient. When they call in for vaccination, we put them on the list so that way that when we open a bottle, we need to have 10 people to be vaccinated. So we call people come in from the list to get vaccinated. So people can call and we put on the waiting list. And once we open the bottle, we just call and come in. And there's no waiting line. They just come and get the shot, be observed, and then go home.
Oh, there you go. Doc, anything in closing?
No, that's it. But guys, just get vaccinated, practice the 3W, and let's keep the cost score low as we are in the past, 2 months or so. And we have a good year. That's what we want to be, okay?
So we're going to have a good year.
We're going to have a good year.
Okay.
I'll keep my finger crossed.
Guys, we're going to have a good year. Doctor's orders. Thanks, Doc.
Have a good day.
The prescription is to be positive. The prescription is to be positive.
The only negative we want is negative test results.
Oh, yeah.
Oh, yeah. 757, we're KUAM FM in Agotni, Guam. Coming up, we do have Hannah Cho from Department of Labor. They've got a little announcement they want to make. We'll catch up with GORA's Executive Director, Ray Tapasnia. We're going to